I think Lesley and I set out in this project to grapple with some of the deep and abiding questions about how and why healthcare works and why healthcare matters. And sometimes these big questions seem almost impossible to frame when we consider the complexity of the healthcare that goes on around us every day, every minute, every second around the globe. But from time to time, it is important for us to take a moment or several moments and think about how and why the structures of relations that form and reform, that build, decay, and get rebuilt, why these structures exist, how they function in terms of the energetic transfers and transactions that at its core make up a lot of what healthcare actually does. When faced with the complexity of the individual lived experience of our patients, when we consider even the same disease entity but in different people, for us to do really valuable work, we need to understand the lived experience, the context of how that disease plays out for that person at that point in time. And as doctors, that's the true challenge of what we do in healthcare. It's not just about what we know and what we can do, it's how we make sense of what we know and do in relationship to the patient, in relationship to the health service in which we're working and the resources available to us at that time, and within the limits of what's ethical and responsible in terms of delivering healthcare to people in need. And when faced with big questions like this, it's important to have a foundation to understand why and how people engaged in healthcare either achieve that goal of restored or maintenance of good health, or we're in situations where things go wrong, understanding how and why that happened so that we might avoid those mistakes into the future. And in shorthand, we call this quality healthcare.